I'm Sharon O'Connell.
And I'm Roger O'Connell, and I dropped dead on the tennis court at Synergy on July 4th, 2004. The emergency response team rushed me to St. Luke's Wood River Hospital, where the emergency room staff fortunately knew what they were doing, took care of me, called for the medevac, and arranged for transportation to Boise, St. Luke's. St. Luke's and Boise, cardiologist performed a procedure that was new in the country, one of only 4 hospitals, chilled my body, minimized mental and physical damage, did a 4-way bypass, and kept me alive.
Roger O'Connell's story is not unique. More than 8,000 times each year, both full-time and part-time Wood River residents come to this new hospital for emergency care. Sometimes these emergencies are relatively minor, like strep throat, badly sprained ankles, and serious cases of the flu. But sometimes emergencies are life-threatening. In either case, the St. Luke's Wood River Medical Center Emergency Department, staffed with all board-certified emergency physicians, is here 24 hours a day, 7 days a week, 365 days a year to serve our community. I'm Tim Ryan, and like so many of my friends and neighbors here in the Wood River Valley, I know how essential this hospital is to all of us. Indeed, St. Luke's Wood River Medical Center is arguably the most important nonprofit community organization in the region. First, this hospital emergency department is absolutely essential to the well-being and peace of mind of every man, woman, and child in this valley. A few of us, especially the part-timers, may have the resources to travel to Boise and other cities for elective medical care. But if we experience significant medical emergencies, our short-term health, even our lives, will depend on the highly trained medical professionals and outstanding emergency facilities here at our local hospital. Second, this hospital is essential to all of us because the community we love simply would not be viable without it. The thousands of residents who make Blaine County a real community, the wonderful community that attracted us all, would not and could not be here if their families did not have a good hospital close at hand. As you will learn in this video, it's not easy to operate a small hospital in a community of just 21,000 people, especially in a resort community where patient volumes fluctuate significantly with the seasons. But operating a hospital that aspires to be one of the finest small community hospitals in America, which is what our community expects and deserves, is a very tall order. This is the story of St. Luke's Wood River Medical Center, its history, its accomplishments, its healthcare services, its challenges, and its enormous impact on our community.
Until the year 2000, the Wood River Valley had 2 small hospitals serving a county of 16,000 people, a population that could barely support 1 hospital, much less 2. In 1994, the City of Sun Valley, the Blaine County Commissioners, and the Wood River Medical Center Board of Directors concluded that healthcare in the valley would best be served if the city and the county got out of the healthcare business in favor of a single, new hospital operated as a private, not-for-profit organization. St. Luke's in Boise, a top-ranked regional medical center, was invited to participate in creating a new hospital facility that would be owned and operated by St. Luke's. By November of 2000, the $35.5 million, 110,000 square foot, 32-bed St. Luke's Wood River Medical Center was a reality. $20 million in community donations, along with $15.5 million from St. Luke's, funded the cost of constructing and equipping the new hospital. A $6 million transfer of assets from the existing 2 hospital facilities provided startup working capital. No debt financing or taxpayer assistance was used.
On July 1st, 2006, St. Luke's Health System became an official entity consisting of 4 hospitals: St. Luke's Boise Regional Medical Center, St. Luke's Magic Valley Regional Medical Center in Twin Falls, St. Luke's Meridian Medical Center, and St. Luke's Wood River Medical Center. The hospital system and all 4 affiliates are not-for-profit, tax-exempt healthcare organizations. Health systems such as St. Luke's allow their member hospitals and clinics to realize significant savings in purchasing supplies and equipment and borrowing capital funds. These systems also provide essential information technology infrastructure that small hospitals could never afford on their own. Moreover, systems help in personnel recruitment when nurses and skilled technicians are in short supply. In 2003, St. Luke's Wood River was designated by Medicare as a critical access hospital. Due to their remote rural locations, these hospitals are far more financially challenging to operate than most. Medicare, therefore, reimburses these hospitals at a higher level in order to help them survive.
When St. Luke's Wood River Medical Center opened in 2000, our community-based board of directors made a bold decision. This would not be an ordinary small community hospital. Befitting the community it served, this would become an extraordinary community hospital, indeed the finest community hospital in America. This vision has driven the development of the hospital's healthcare services and programs ever since. It has also driven the recruitment and retention of exceptional physicians and staff. In the face of the toughest healthcare financial crisis in American history, a national nursing shortage, and the difficulties faced by all hospitals serving small communities with limited patient volumes, St. Luke's Wood River Medical Center has already achieved remarkable results. Here are several examples.
As part of its commitment to excellence, St. Luke's Wood River meets or exceeds many nationally recognized healthcare standards, such as its accreditation by the nationally recognized gold standard of the Joint Commission. This accreditation helps the hospital ensure that it is using best practices in everything it does. Only 4 of 26 critical access hospitals in Idaho have received accreditation from the Joint Commission. First, knowing that emergency medical care was perhaps its community's highest single healthcare priority, the hospital set out to create a superb emergency medical response network. The hospital started by leading the effort to bring paramedic-level emergency medical services to the community with the support of the Heinz Family Foundation. There are now 27 paramedics available to provide 24/7 response to emergency calls from anywhere in the valley every day of the year. This effort also gave the hospital an opportunity to focus on integrating emergency response care with the hospital's ER. Emergency physicians work closely with paramedics, fire and rescue, and law enforcement from a patient's initial 911 call through arrival at the hospital. Next, the hospital built a highly qualified nursing staff and has recruited dedicated emergency physicians who are on-site and available to treat patients 24/7, which is unusual for a small hospital. Third, and perhaps most important, the hospital board made a decision to recruit board-certified emergency medicine physician specialists to staff the ER. All of the physicians working in the emergency department hold this important distinction. They are specially trained in emergency medicine. This makes a tremendous difference when people are acutely ill or have suffered major trauma, because these physicians know how to do everything right and in the right order to get the best possible outcome.
Emergency medicine specialists are rare nationally, and in rural hospitals, they're virtually unheard of. St. Luke's Wood River is the only hospital of its size in Idaho that has all board-certified emergency medicine specialists. We also made a decision to have highly trained emergency nurses, the kind normally only found at major metropolitan hospitals. Our nurses and technicians are trained in a greater range of emergency care than is common for a hospital of our size, and hold certifications comparable to those normally found only in a major metropolitan ER.
For patients who need quick access to advanced physician specialists and services, Air St. Luke's helicopter and airplane provide airborne critical care units with highly trained professionals and the extensive equipment needed for monitoring and stabilization during transfer. Air St. Luke's features experienced specialty teams dedicated exclusively to the needs of cardiac, maternal, newborn, and pediatric patients. With a new state-of-the-art ER facility, a well-coordinated emergency response system, outstanding doctors, nurses, technicians, and equipment available 24/7, St. Luke's Wood River patients will receive treatment superior to any other rural hospital in the country.
The bottom line for all of this is we've got people in this community alive today that wouldn't have survived before we built this system in this community.
The St. Luke's Wood River Board also wanted a strong surgery program. Consequently, the hospital and its medical staff now conduct over 2,500 surgical procedures each year in specialties including general surgery, orthopedic, spine, vascular, urologic, gynecologic, ear, nose, and throat, and plastic surgery. More important, the St. Luke's Wood River infection rate, a key measure of quality surgical care, is a stunning 0.39%, far below the national standard of 2%. In addition, the hospital has recently converted 2 of its 4 operating rooms to fully integrated operating rooms featuring advanced surgical technology.
The fully integrated operating room allows the surgeon great facility and not having to use his hands to do other things than operating. We have monitors which are overhead right now. And instead of having to walk over to the wall to look at the old x-ray view box or a wall-mounted monitor, we can look at the x-rays right at the operating room table. That's a huge advantage. We also have the ability to use voice commands,
Digital capture?
which allows me to tell the equipment to take a photograph of the arthroscopic field,
Record?
to increase the light intensity, to change the zoom. We can do this without having to move our hands away from the surgical instruments. We used to have to tell the nurse to do that. I think it speeds up the operation and has helped us to do things much more quickly than before. St. Luke's Wood River is an amazing place. I've operated at different hospitals throughout my career, but for a community of this size, it is amazing the equipment we have available to us.
Of course, a patient's first concern is the experience, training, and qualifications of his surgeon. The surgeons on staff at St. Luke's Wood River are board certified in their area of specialty and received their training and completed residencies and fellowships at some of the top medical training programs in the country.
Our board realized that given the remoteness of our small hospital in Wood River Valley, that superior capability was going to be essential if we were going to have a superior small hospital. And having realized that, they provided the funding and the direction to create an imaging center that had all state-of-the-art equipment. Since these capabilities require equipment that is among the most expensive medical equipment available, this was a tall order for a small hospital. But given the remoteness of the Wood River Valley, our board felt it was essential.
Not only does St. Luke's Wood River offer a comprehensive range of imaging services, but its MRI, CT scan, mammography, and ultrasound services have received accreditation from the American College of Radiology. This places these services among an elite group of imaging departments in the nation, a distinction virtually unheard of for a hospital the size of St. Luke's Wood River. In addition to Wood River's own radiologists, the hospital's imaging department has access to 16 fellowship-trained radiologists at St. Luke's Boise who can read digital exams immediately, 24 hours a day, 7 days a week. Perhaps the most basic of all hospital services is nursing care. The quality of nursing care has been under fire nationwide as shrinking hospital revenues and a national nursing shortage have forced many hospitals into higher than ideal nurse-to-patient ratios. St. Luke's Wood River is committed to having highly specialized nurses in all patient care areas and a low nurse-to-patient ratio, both of which are rare for a critical access hospital.
St. Luke's Wood River Medical Center really has a unique critical access hospital environment. In most rural critical access hospitals, there's one pool of nurses that is basically deployed to anywhere in the facility to take care of patients. But at St. Luke's Wood River, we are unique in that we have specialty nursing care areas where a nurse can become highly specialized in either emergency services, medical surgical services, obstetrics, surgical services, and become very highly trained, have the same level of expertise that you would expect in a suburban, urban, or a larger medical center. The St. Luke's Wood River nurse-to-patient ratio is significantly lower than you would find in the national average or at larger hospitals in urban or suburban areas. This really means that the Wood River patients get a lot of time with their nurses, a lot of time at the bedside for direct patient care.
To improve our nursing care even more, the hospital is currently pursuing designation as a magnet hospital from the American Nurse Credentialing Center, a division of the American Nurses Association. Magnet status is the gold standard of excellence by which the nursing profession is judged and would rank St. Luke's Wood River's patient care among 250 of the finest healthcare providers in the nation. The hospital's goal is to be the first critical access hospital in the nation to achieve this distinction. St. Luke's Wood River Medical Center is committed to the recruitment and retention of outstanding doctors.
34 primary care and specialty physicians on the active medical staff at St. Luke's Wood River Medical Center are board certified. Members of the medical staff have been educated and trained at some of the finest medical institutions in the country. In addition to this excellent group of physicians in the Wood River Valley, the medical center offers highly coordinated access to some of the finest specialists in the Intermountain West at St. Luke's Boise.
Funding these levels of excellence in a relatively small community hospital has not been easy, and it would not have been possible without generous community philanthropy. Virtually every one of the examples of excellence just described was funded entirely by philanthropy. The emergency department facility, of course, was funded by the New Hospital campaign, but ongoing community donations have continued to provide essential emergency room equipment and continuing education for emergency staff. The training is part of our continuing effort to develop leadership skills and clinical excellence.
Virtually every hospital and medical center in the country that has achieved advanced levels of excellence has received community philanthropic support to make this possible. There is not a single exception. The margins of excellence in America's finest hospitals have always been funded by individuals, foundations, and corporations who understand this need and who want to make a difference in the level of care available to their families and to their communities.
So that's our story, the story of a difficult but very rewarding journey to excellence. It's been quite an adventure for our governing and foundation board members, our donors and fundraising volunteers, our doctors, nurses, technicians, and other employees, including, of course, the managers. I know they will tell you that the journey has been more than worthwhile. They'll also tell you that it's just begun.
I believe I would not be vertical today if it weren't for the staff at St. Luke's Wood River. We are so fortunate in this valley to have the emergency response team and the St. Luke's Wood River Hospital to serve the people here that have emergencies. And it's because of St. Luke's Wood River Hospital emergency room and the emergency response team here in the valley is the only reason I'm here today. I'm a lucky guy.